As we reach a critical juncture in the pandemic locally, I'm joined now by Jeannette Despatie from the Cornwall Community Hospital. Welcome back to the show.
Good morning. Thank you.
All right, so the hospital put out a press release last week, really a plea to the community to adhere to social distancing measures. We know there's a lot of COVID fatigue. We know that relatively the early parts of the pandemic, our region did really well, but the numbers that we're seeing across the province, across the country, but especially here locally, are starting to become alarming.
They are beginning to become alarming, and we're certainly seeing that on the hospital system across the province, but even locally, when we look at our current numbers and any pressure on these resources is having quite a significant impact. It really feels like there are exponential increases, and I know we're seeing that when we're talking about over 4,000 for the province, but that translates into significant increases in our community. I know that you'll report on these numbers coming out of public health today, but increases over the weekend that are quite frightening. And we are actually currently at 14 positive COVID patients admitted in our hospital. They're really spread across the hospital. Some are in the critical care unit too. This morning we're in the critical care unit, and others in medicine units in the ER.
And of course, we know that there is a segment of the population that sometimes downplays the severity of COVID-19. So let's talk a little bit about those hospitalizations and those critical care unit patients, the effect that it does have, and the resources that are needed at the hospital to take care of their conditions.
Absolutely. So thank you for that. We do know that these patients can become very sick. So of the 14 patients currently in hospital, 5 were transfers in from long-term care facilities where there were known COVID cases that needed extra medical attention. We also had the remainder are really patients that are coming to us, known COVID positive patients from the community that are really not doing well. After a few days, they're needing medical attention that we need to provide in hospital. So it is a virus that can hit people very hard. We've seen 45-year-old patients in the critical care unit for several days battling this virus. So no, not to be downplayed.
And of course, when we talk about hospital resources, we know that we have a great facility and a great staff. But at the end of the day, space is what it is, and there is a risk of overloading if the trends continue.
That's right. So those resources eventually become finite. Of course, for example, today we had increased our surge capacity up to 188 beds. This morning we had 187 patients in hospital. So of course we'll be going to another tier level to open up capacity, but that means things like canceled surgeries and the like. So really starting to impact the other medical resources that we need to be providing to our community. The other resource that you mentioned are our medical professionals. So our doctors and nurses are not immune from this virus, and that's really why we need to ensure that we limit the spread in our community, so not to in any way compromise their ability to function and their protection as well.
And you mentioned, of course, those other procedures and things like that have been postponed. But at the end of the day, emergencies happen, and every bed that's taken up by a COVID patient is one less that could be there for someone who suffers a heart attack or a stroke or a car accident or things of that nature.
Absolutely. That's one of the biggest concerns we as healthcare providers and hospitals across the province have is being able to ensure that we are prepared for the next emergency that could very well be a non-COVID emergency. Just to speak to the capacity issue, we did receive direction from Ontario Health late last week, all hospitals to prepare for and ramp up to receive patients from other communities that can't be served because they're actually over capacity. We know that, for example, in Toronto and Windsor, they've actually maxed out and are beginning to send transfers of patients across the entire province. So not unheard of for a transfer up north just because there may be a critical care bed. The projections do not look good. There is concern that we will use all critical care beds in the province before we get through this.
And I think it's important to note as well that Cornwall really is the primary critical care unit facility in our region.
That's correct, yes. So we're trying to serve our region, and we may well receive requests to serve well beyond that if we have any sense of capacity at all.
And of course, you mentioned earlier that many of the patients are from long-term care homes, but there's a sizable amount that really were just in contact with COVID-19 cases, and in a way, those are very avoidable. We're being told to stay at home and to limit our gatherings, and our to really bubbles don't exist anymore. So maybe we can finish off with that kind of plea of what people can do really to support the initiative to really, as we continue to fight this pandemic.
Absolutely. I think you said it well. Bubbles don't exist anymore. Just as difficult as it may feel, we really do need to limit our contact, and there just don't take that occasion to make one exception. Anything that's not essential, please do not engage. We really need to limit the interaction. Right now, we're paying for those interactions that occurred over the holidays. We need to get through this without any other impacts. I did want to remind folks that we are still open for those needing care, of course. So the emergency department, if you're in need of medical attention, not to hesitate coming. We do have preventative measures to make sure that you are cared for if the need exists.
That's excellent to know and reassuring to know that the services are still there. So I want to thank you very much for joining me. Thank you again, as always, for the work that you do, and of course, all the staff at the Cornwall Community Hospital who are really our heroes during these difficult times. But again, all it takes to be a hero in the community is to stay home as much as possible, avoid gatherings, and get those numbers down. So thank you once again, Jeannette.
Thank you. Appreciate your time as well.